Okay, we're just doing a post check on Kim's ankle here. Adjusted it this morning. She had a little bit of relief, but sounds like it was short term. She went and walked around for a little bit and then started bugging her, and she booted it again. So we're just checking it before she heads over to Seattle area.
Yeah, it's real sore. I mean, I had my tennis shoes, my nice tennis shoes, with my orthotics in them, and we were just about 8:30 this morning. This is about 3:30 in the afternoon, and he's going to recheck it all over again. Go ahead and check it, because you had it completely freed up.
This morning, the dorsiflexion was pretty restricted, and the laterality was not as big of an issue this morning. And we compared to her right ankle, and it's pretty drastic how much more force I have to use on this one to get through that same dorsiflexion range of motion. So it's not as bad as it was when she came in this morning, but it does look like we've lost a little bit of that dorsiflexion already.
All right, so there's a shift of the.
We're not going to adjust it from lateral to medial, but we're going to set it back in there from superior to inferior back in there.
Okay. And what muscle is it? Is it the muscles? I mean, what muscles kind of let it fall out of place, or what muscles are letting it fall out, maybe, or what muscles are, not pulling it back where it should be? All I can tell you is I'm like sore everywhere around my ankle. I'm like sore under there. Really, I'm not.
There's a little mild edema right here. Okay.
Okay.
So we're going to set this bugger here.
You want me to relax it?
Yep, there you go. Right there. There we go. There we go. Pretty good. I think we can get a little more. We're going to give another shot here.
Okay.
Try to let this just relax for me there. There we go. Okay. So basically we just set that straight, superior to inferior, or anterior to posterior, however you want to think about it. Freed that up quite a bit. So we're going to tape it.
We're going to tape it and immobilize as best we can, and to keep it that way so when we see the next doctor's appointment on Friday, right?
Yep.
Well, thank you, Scott, for confirming. I mean, you confirm. I'm going to look at you now. I'm lifting my foot. You confirm, I mean, by your hands-on clinical evaluation here, what I try to describe to you as, I feel the spasm, I feel the pain, and what I'm feeling is rightly, would you say, is rightly justified from, it's not just the muscular, it's not just these other soft tissues around it. The bone's not in neutral, and then the soft tissue around it is flared up.
Yeah, and it's just trying to protect that joint. If that joint's not moving properly, you're going to get inflammation, and those muscles are going to start to contract to limit your range of motion so you don't cause more long-term damage to it. That's what they're trying to do.
Well, thank God there's not really any major arthritis on my x-rays or anything like that, just one little spot.
Just a little tiny bit there. But all in all, it looks like a pretty good joint from an arthritic standpoint.
Well, thank God for that. Just can't keep it. It's obviously my muscle patterns around the ankle have gone so long in a bad position due to all the compromises and joint instabilities for God knows how long. Over 11 years, I probably was predisposed to some of this, and it. I mean, from a chiropractor point of view, I mean, would you say, that this joint really does move? I mean, is it hypermobile, or what words would you describe? I mean.
Well, I don't know if it, all I know is when I see that talus is moving quite a bit. So there's probably a little bit of hypermobility in there. It's definitely wanting to go superior though.
Yeah, and my right foot doesn't have any of these problems, does it?
right now that's we checked that this morning and again, and it's moving really well.
It's moving well, staying. In other words, it's moving, but also staying where it's supposed to stay.
Yep.
The left one moves too well, gets out of where it's supposed to stay, and then gets kind of stuck and it's out of neutral. Then all the things guard around it. You put it back into neutral. You get my foot dorsiflexing, and everything is copacetic. But as soon as I walk out of here, things change.
Yep.
Well, thank you, Scott, for all your help and for your best evaluations, and I appreciate you. Thank you very much.